we normally do these with you?
No. Been seeing them. You do them though.
You jealous?
A little bit.
Maybe. We'll come back to this. There we go. We'll do that push there. There we go. Making me work always. All right, we're gonna do that pull. Ooh, that was good.
Yeah, I feel like it's been a while since we've done that one.
Yeah.
Ooh.
Doing okay?
Mm-hmm.
What's that feel like?
Not great.
Does it feel okay now?
Yeah, it's good.
So alcohol coming at you. You get that nice alcohol smell. So I'm gonna have you clench down. So you feel the masseter muscle belly here. Perfect. Hook. Actually, if you talk, you guys see the needles move.
Yep, I can feel it.
Okay.
It's a little weird.
And again, we find the zygomatic arch right here. And then that pulse, I can feel that with my finger right there. We don't want to hit that artery. So we can go up a little bit higher, right into there. And very shallow muscle. I'm not going to ask you any questions because it's already uncomfortable. I'm really excited to announce the drop of Dorsa tools. I've been in the health and wellness space for years and have seen that there is a need for better quality products for both practitioners and patients. So do me a favor, the link above will take you to our launch site so that you'll be first in the know when our products drop.
Your hair matches this little pink light.
Alright, yeah.
She did it on purpose.
Totally.
So we're here with Liz. She has been having some tennis elbow or lateral epicondylitis. That's a lot to say. But we're gonna do some needles there. There's a really cool needle set. She's been having for like a few months or kind of forever. We've been working on this issue here. There's a cool trigger point that goes into infraspinatus, and that will actually refer down to here. So curious if that kind of relates, but we'll do a full needle set there, and she's gonna be brand new. Are you lifting today?
Yes.
Cool, so we'll be able to give it a trial run with that. Okay, we're just gonna get into it. So I'm gonna have you go onto your stomach, looking this way. Cool, low back and everything's been feeling pretty good?
Yeah.
Okay.
It's a little tight. I had legs yesterday, and so my legs are really sore,
Okay.
but that's it.
Do too much muscle work so you're not screaming on camera. But cool. I feel like with my normal patients, it's like hard to like create discussion that's not just like, how's your life for the whole YouTube
Yeah.
But we'll probably skip through a few things here. And you do really well with the adjustment with your head forward, and then we do that little twist, so we'll kind of do that one as well.
Okay.
All right, let's kind of warm up the spine.
Because I remember with that rib issue that I have, I like every time it pops out, you have to get it in like a different way.
Yeah,
Oh, it's so complicated.
you're a difficult patient.
Great.
I am too though. I like don't like when I adjust. I like don't make the big cracking sounds, and it's not always like the greatest effect. I have to like hold back my tears a little bit.
Sometimes, yeah.
It's like that for you.
A little bit.
We got tissues.
I'll leave and I'll just sit in my car. Like that.
So
In a good way, but.
go in the shower and just cry. Right. Okay, let's go ahead. I'm gonna have you face me on your side over here, and we'll come back to this. Cool. And then go ahead and look over your left shoulder there. Good. Drop this down a bit. And you can hold right there. Cool. Good. There we go. With like our regular patients, there's no reactions because you're like, I've done this 100 times.
Yeah.
Look right here. Good. There we go. Cool.
Definitely needed those ones.
Yeah. I need that one today, actually. All right. And we're gonna do our push. There we go. One more. too. Okay, let's see if we can get this neck for the third time.
Okay. This usually gets it sometime.
Yeah, I want to do a little bit of soft tissue before we get into it.
That's good.
What's the workout of the day?
I have no idea.
So you did legs yesterday?
Yeah, I have a new plan, a workout program. And it's aggressive, so looking forward to it, but I have no idea what I'm doing.
Okay. Are you competing?
No, I'm not. I'm in a wedding come October.
Oh, cool.
So I'm like, you know what, maybe I should buckle down in the gym and not be so lax about it.
Yeah.
You know, so I can look and feel my best. But I'm planning on getting back into jiu-jitsu after.
Oh, cool. I didn't know you did that.
Yeah.
How long have you been doing that for?
I did it for like last summer. It wasn't anything too long. But so you might be seeing me more for my issues after that.
Man, jiu-jitsu is
Once I get
aggressive.
into that, yeah. I love it though.
Yeah, I have like a wrestling background, so
Okay.
whenever I do jiu-jitsu, I have like more of that mentality.
Mhm.
But jiu-jitsu is very much more of like a chess match.
Mhm. It's like a slow burn,
Yeah.
and then you'll get them.
Are you competing with that?
I hope to someday. Yeah.
Do they do the Nagas out here? Or,
Yep.
Yeah.
I think so.
Okay.
I think they do.
They always. It's funny, like when you win in those competitions, it like they put that little banner in front of you saying like world championship thing.
Yeah. And you're like, there's 8 people here.
Yeah.
Yeah.
Makes you feel good though.
Oh, no, totally.
It's the little wins. Do they have like a Naga that's like best of the best type of thing, or is it?
I'm sure there are these. I follow some like jiu-jitsu competitors on social media, and they go to these big championships in other countries, and yeah.
That's cool.
I
So
think you have to be like invited, probably.
okay.
You have to win.
Won a few.
It's like
of them.
in the sense like bracket style. Like if you win a competition, then you get to go to the next level and kind of thing. I think.
Something like that. That makes sense.
Yeah.
You can't just show up for
No.
championships.
No.
What do they call it if the local ones are the world championships? Do we call it the universal championships?
No idea. I'm not that into it.
Jiu-jitsu is, I feel like it's the adult.
Wrestling.
Or yeah, like when you get too old, too many injuries, you
Mm-hmm.
jump into jiu-jitsu.
Definitely.
All right, we're gonna go full speed on the neck and see if we can-
how it goes.
Yeah. Okay. So we're gonna start onto this side. We'll do that push there. There we go. Making me work always. Goes the same thing.
There we
Those
go.
are good.
Got him.
Yeah, the first one I was like, that's not gonna work for your neck. We need.
No, I don't think we've ever done that one before, either.
Hit or miss.
Right.
You're cool with the towel?
Yeah. Sure.
Alright, go ahead and lift the head up there. Cool. Pick the hair just to match the lights over there.
Totally.
Thank you. Very aesthetic, artsy. Alright, we're gonna do that pull. Ooh, that was good.
Yeah, I feel like it's been a while since we've done that one.
Yeah, almost got it.
Yeah.
Let's get all the other joints and then we'll kind of
Perfect.
hyper focus in.
This wrist was giving me issues like last week, but
Okay.
it's better now.
So it's like all this right side.
Yeah, it's all fucked up.
Ah, there we go. I think you have too good of mobility in the knees. Let's see.
Ooh.
Oh, I lied.
This one gets really tight. Like this will get tight,
Mhm.
and then my knee will just get cracky.
We got it. Is that fitting there? You're performing well with the cracks today.
Awesome.
Thank you.
My body's listening.
It knows it's on camera.
I guess.
And then this arm's just perfect.
Mm-hmm.
Why do you think you just have it on the right arm?
It's probably from all the dislocation, the softball, everything.
Okay, makes sense.
I'm assuming that's kind of it.
Just more use. Cool. All right, let's do this. So we want to hit coracobrachialis here. So she has tennis elbow, which is basically kind of like an overuse syndrome. So it's when you kind of pull back here, these muscles, your extensor wad kind of gets overused. And that will sometimes put stress on the tendons that click into the elbow there. Really frustrating injury because it's typically, something it's caused by something that you like to do, which is lifting. But we have a really cool treatment that we can do. We did it last time. I'm going to hit a few different points here. Do you feel like that was helpful last time?
It definitely helps, yeah.
Cool. Is that a good angle over here? Kind of. You're a pro with the needles.
Yeah.
We don't have to explain anything. Is the elbow comfortable there?
That's good.
Okay. Cool. Yeah, I was working with a hand specialist or an occupational therapist at a seminar I went to last week.
I was going to say, how'd that go?
It was good. Learned a lot of cool things. Focused mainly on like dry needling of the... I'm out of these needles. Focus on dry needling around the thoracic spine.
Okay.
So that's where you can get into some dangerous spots just because the lung field is right there. And so it kind of just teaches you techniques on how to not pop somebody's lungs and send them to the hospital.
That's probably a good idea.
Yeah, it happens.
Did you learn about the TMJ that you said that you...
Do you have TMJ stuff?
Yeah.
Ooh, do you want to do that today?
If you want.
Yeah, it's really cool.
Yeah, sure.
Yeah, I did. It's not as crazy as I thought it would be. You have 4 muscles of mastication, or your chewing jaws. And so we can get temporalis and masseters, and we can hook up a circuit. Somebody did it to me in the seminar, and they had the unit turned all the way up. And so as soon as they tapped the needles, my jaw just like the teeth closed really hard. And I was like, whoa. I was like, that was a lot. But apparently we get pretty good results. So we'll work on that a little bit.
For sure.
Too.
Because like I've said, I've done like the release, like with a massage therapist, like through my mouth. Yeah. But that only lasts so long.
Yeah, that's how I feel with like muscle work with the jaws. Like it feels good for like a day or two.
Yeah.
But we want something that can
go right back into
like
it if you clench your jaw and your sleep. Like that's what I do. So
yeah, so I've had a few patients that we do laser with where they've had like multiple surgeries. Once you get into like the jaw surgery stuff, it just like I don't know, it's a little bit sketchy. You want to try to avoid that stuff. So
for sure.
Yeah, cool. Okay, yeah, we'll do that too. So first one, we're gonna just thread this through the extensor wad here. So can you kind of see that? So we'll do a little poke. Like get some twitchies. How we doing?
Good.
Is that achy?
A little bit, yeah, I can feel it for sure.
Cool. These needles are longer than I need them to be, but we ran out of 50 millimeters, so.
Great.
No, you're good. That doesn't mean they're going in.
Okay,
there. Cool. So coracobrachialis, we just move the bicep to the side, and that will also kind of click into that elbow spot. So we are gonna do a poke right there. Yeah.
Yeah, I felt that one. Ooh.
Doing okay?
Mm-hmm.
What's that feel like?
Not great.
Does it feel okay now?
Yeah, it's good.
Very good. We'll come back to this. Cool. And then go ahead and look over your left shoulder there. Good. Drop this down a little bit. And you can hold right there. Cool. Good. There we go.
I don't think we've done them up there before.
Yeah,
We just kind of keep them more on the forearm.
So I just ran out of the long ones. That's why it's like sticking out so far. So we will put there. And this will go here. And I'm gonna just slowly start turning this up. Let me know when that starts to feel good.
Okay.
Ooh, already pumping.
Yeah, I think that's pretty. It's moving. It's working.
Is that a good spot? You wanna go a little bit more?
We'll do a little more. See what that does. Ooh.
Yeah.
Sweet.
So I got pretty close to where the supinator is. The supinator is what turns the arm that way.
Okay.
So that's why your wrist is moving like that. I'm going to turn up the frequency a little bit more. So we'll go faster. Is that more comfortable?
Sure.
Okay. Cool. And then while we have that going, I'm going to put the laser there and we'll get into the TMJ. We're just going to do like 100 things at once.
Sweet. Fuck me up.
Cool. And for the people on YouTube who haven't heard me explain this 100 times, the laser basically helps to decrease inflammation and speed up the healing process. It's exceptionally good with things like tennis elbow or anything with tendinitis, so it has itis at the end, so it's inflammation. We get really good results with this. And it's kind of one of those things when we have an athlete who is not going to stop working out, we're able to kind of get ahead on the healing process without having her take breaks. So, cool. If you want to take my chair, TMJ stuff. Let me know if the tension on there feels good.
Mm-hmm. It's aggressive, but it's good.
Okay. Cool. So alcohol coming at you. You get that nice alcohol smell.
Yum.
And then this is kind of go up in the hairline.
Okay.
I don't know how great alcohol is for your hair.
Probably not great.
We have to.
Clean it up a little bit.
Yeah. Cool. Let me find some small needles. I actually just got all these free samples. I'm gonna try them out.
Perfect.
Because they're a lot
I'll be your guinea
smaller.
pig.
So they're acupuncture needles. Usually I use like 40 millimeters is like my shortest one.
Mm-hmm.
Which we don't really need that much length. These muscles are pretty shallow.
Okay.
But bear with me because I've not used these
All good.
needles before. I think these will work with the stem. Yeah, they're like super small. Okay. So let's do a quick little assessment. Do you have a good angle for all of this, or would it be easier if you came over here? That's gonna be, because I'm gonna be here for a little bit.
You're on that side though. It's cool because when I'm right here, I can see her arm switching at the same time if you want that, but I can go over there too.
Focus to be on the jaw. Okay. Good?
Mm-hmm.
That's good. Cool. So, can you get that too? Is that in there? Or do you want to like shoot it from this side? Okay. Is that good?
Wherever you want me, just tell me.
I don't know, just whatever
A
looks
little
good.
point of view action.
Yeah. Is that blocking the light? Do you want me to move this over?
It's okay, a lot, but I'm
Okay.
actually not backing it right there.
Okay, cool. Yeah, let's just kind of see the jaw open up. So, cool. So pretty even. Do one more. Okay, perfect. So we'll start on the masseters. I hate that the first time I'm using these needles is on camera because people are gonna judge me. But I think we use
Yeah, all
this
the
little
comments.
tip. Yeah. All right. So I'm gonna have you clench down. Okay. So we feel the masseter muscle belly here. We're gonna go right over the jaw. Can you clench one more time?
Mm-hmm.
Cool. And you can relax. Perfect. Hook. Perfect. How's that feel?
Good.
You're gonna have a bunch of needles sticking out of here.
Sweet.
Kind of like these needles. Alright. So for temporalis, we just find the zygomatic arch. There's an artery. We can feel the pulse right there, so we want to avoid that. We're going to go up a little bit higher, kind of where that muscle mass is, but it's a very thin muscle, so it's not going super deep in there. And you feel a little achy spot?
Yeah.
Okay,
Yep.
perfect. Actually, if you talk, you guys see the needles move.
Yep, I can feel it.
Okay.
It's a little weird.
Yeah. Cool, we're going to get the other side. Yeah, it's kind of like when you're at the dentist and the dentist asks you a question, you don't have to talk if you don't want to, because that might be a little uncomfortable. Okay, so I think we'll be able to see it a little bit better on this side. If you can clench for me one more time. Good, relax. Okay. Perfect. A little achy. I keep wanting to throw the casing away, but I forgot with acupuncture needles, they just give you one. Shout out to whatever company gave me these. They're doing great for the TMJ stuff. Okay. And again, we find the zygomatic arch right here. And then that pulse, I can feel that with my finger right there. We don't want to hit that artery. So we can go up a little bit higher. Right into there. And very shallow muscle. So, all right, you look like an alien.
Hell yeah.
Turn that guy off. You cool to keep rolling with the elbow? That feels comfortable.
Yeah.
Actually, I lied. I'm gonna steal the elbow stuff, so we can use it for the jaw. I'm gonna be a lot nicer than when I had this done on myself.
Please.
Cool. Yeah, so clinically, in my course, I had a lot of people talking about how great this was for their TMJ clients. So I've never really had anything that I've liked to use for TMJ, because, like you said, it kind of helps you for a few days. So I'm excited to get your feedback to see if this helps for a little bit longer. Okay, so you're gonna feel kind of the jaw opening and closing. We don't need to be crazy with it. I'm gonna start on the left side. Let me know when you start to feel anything.
There, I'm feeling
Okay, is that a good spot? You want a little bit more?
it. Let's keep it there. Just I'm a little nervous. It's my face.
Yeah. Okay, and then we're gonna do the right side, same thing. Is that good there?
Yeah, that's good.
All right, we'll let you kind of cook for a little bit. I'm gonna increase the frequency, so it's just gonna go a little bit faster. Is that good there? Okay, cool. We can do laser, but I want to kind of see if just this helps.
For sure.
As far as, just taking one variable at a time.
Mm-hmm.
That way we know that it's the dry needling and not the laser. I'm not going to ask you any questions because it's already uncomfortable. Let's slide this guy through. There we go. Cool. You look so cool right now.
Mm-hmm.
I've had there's an office that we work with next door, and they'll have they have acupuncture, and the patients will come in after they have acupuncture. There's been like multiple times where the patients will come in and they still have the needles in like the top of their head. Or like I'll see them on the floor and I'm like, that's not my needle.
Yeah, that's not good. I'm gonna walk out without it.
Yeah, I hit up the acupuncturist. I was like, hey, just so you know, like, you're leaving needles.
You're leaving needles in your client.
But it'll be like patients that have paralysis, so they can't feel the
They can't feel it anyways.
Except I've had like a few where they leave the ones in the top there.
I only got acupuncture like once, and it was interesting.
Yeah.
Interesting experience, that's for sure.
Go ahead and sit on up. You're needle free.
Beautiful.
And we did all the needles today. Swing the legs around that way. Let's just get some shoulder pops in. And actually, let's do a little bit of scraping like we normally do through here.
Perfect, yeah.
We're going to do a pull up right here. Good. Do we normally do these with you?
No. Been seeing them. You do them, though.
You jealous?
A little bit. Maybe. Like, I just don't want it to fuck my shoulder up.
Yeah.
You know, with those issues.
And you've had the dislocations.
Yeah.
Let's go ahead. Can you pop the shirt off and then I'll do some scraping
Yeah,
in the back?
for sure. All the way off or like halfway?
Oh, yeah. Start like
Yeah, that's fine. Okay.
Alright. Is the lighting so good?
Okay, do you want me to sit, turn around so you can have that?
Yeah, let's do that.
Yeah.
Cool. This is our normal routine.
Mm-hmm.
All right. Bring your right arm behind your back. Perfect. So yeah, we have a referral point from your infraspinatus. So there's the spine of the scapula. The infraspinatus kind of sits right in through here. Are you tender through that spot?
Definitely not like if you pushed any harder for sure.
Okay.
But
so that little trigger point can actually refer into her elbow pain as well. But we did a lot, so I don't want to overdo it. We'll just get some scraping in and you'll be good to go.
sounds good.
We can hear the taco business next door. She talks really loud when she's throwing out her orders. I'm curious if that makes it into the clip. Alright. And then let's actually have you swing the legs again this way.
Okay.
And you'll work with me a little bit. I'm going to have you tuck your chin down towards your chest, and let's pull this arm all the way across. And a few big breaths through there. Does that feel like the right neighborhood?
Yeah.
Okay. You're gonna be Superman in the gym today.
Seriously.
I always feel like that after like getting body work done.
Mm-hmm.
Like I have more
Like
range of
things
motion.
are loosened up. Everything's working.
Locking it in. Cool. Well, I think that is all I've got for you today.
Perfect. Awesome. Thank you.
Good stuff.
As always.
Yay. I think that was a good video.
Oh
Some cool new stuff.
For sure.
That TMJ
You're
stuff.
like, let's just do your face. Let's do my face. Back me up.
Yeah, you're on camera, so you can't say no.